Hi, in this video, I'll be interviewing Rosie Ingebritson, clinical oncology social worker, about grief and cancer. Lots of losses are experienced during cancer and its treatment, and Rosie's going to talk with us about that. Thanks, Rosie, for being here with us. Grief is such an important subject, and we often think about grief with just death, but there's so many other different kinds of losses. What other kinds of loss would you say you've seen in working with people who've had cancer and in those who love them?
Yeah, I'm so glad we're talking about this. So you're right that grief, we do, I think, as a society, we kind of associate grief with death only, and only after a loss has occurred. But the truth is that grief is, something that affects people throughout their cancer experiences, and it's something that affects everyone throughout their lives as in times of change. And cancer, of course, is a huge time of change. So some of the sources of grief in a cancer experience might be physical loss of, it might be as concrete as a body part, if you're recovering from a mastectomy, for instance, and there may even be some anticipatory grief beforehand in coping with that loss or that upcoming loss. Or it may be something less tangible. So, in the physical realm, it might be something like just, a change in your ability, in your day-to-day energy, things like that. There's a lot of grief in the cancer experience that has to do with who you were before and who you are now. So, it might be those tangibles. It might be the loss of your hair, the loss of, your sort of physical feeling like yourself. You might look different or seem different, and seeing those changes in yourself, whether it's in the mirror or in your interactions with others, can definitely generate a lot of feelings of grief. And then, when we think about that sense of self that you might be grieving over changes, a lot of that can come from role changes within the family. So, if you're, let's say, a mom of adult children, and suddenly your adult children are taking care of you, that happens a lot in cancer, and it brings a lot of grief with it, because those transitions are sort of supposed to happen over the course of a lifetime. And with cancer, they can happen overnight. And so that shock and that change can definitely generate a lot of grief feelings. And they may surprise you, because I don't think we talk about grief in this context as much as we should. And so, those feelings are normal, and they're significant, and they're really painful.
Thanks so much for validating the different types of losses that people have when they go through a major life change. One of the things I've had my patients tell me is things like, I had this story for myself about how things were going to go. I thought I was going to have children, or I was up for a promotion, and this derailed everything. Can you talk a little about some of those other sort of, existential losses that people have?
Yeah, so, when I was talking a moment ago about the different types of grief, just now you mentioned someone who said, I thought I'd have children, and that's when I neglected to mention that's so important. Loss of fertility can be a part of cancer care for younger patients, and that's huge as well. And yeah, those existential, we all have someone in one of my support group calls it making movies. We all make movies about our life, right? What we expect it to look like one day or even next week. And when there's a sudden disruption in what the rest of your life might look like, or even the next year of your life, that's traumatic, and it's not something that you're going to be able to just cope with overnight. A really important piece of coping with grief is how it's not linear. I think the expectation, a lot of folks who've had a loss, a death-related loss, have this experience where in grieving, folks expect, okay, it's been 6 months or it's been a year, so now things are normal again. I think that, or they should be. Whereas the person grieving is like, whoa, this still is coming up for me at the most surprising times, because again, it's not linear. And that's the same thing I think with grief associated with the cancer experience, and those losses, those sort of existential losses of parts of your sense of self, of your dreams and goals for the future. They might come up rather spontaneously. Suddenly you find yourself thinking differently about your life, thinking differently about the future, and it can trigger a lot of grief feelings. It can also trigger opportunities for growth, about when life changes. There are lots of opportunities to find new senses of meaning and purpose, and those things do come with grief. But that's not to say that that's a silver lining, right? That's just part of this process too. So, I think, in terms of those existential griefs that you mentioned, or those sources of existential grief, it's just important to acknowledge that they're there. That grief doesn't have to be something tangible. It can be a feeling of loss that sometimes you can't even quite pinpoint. You just know that you feel it.
I know in your work, Rosie, you hear a lot of stories, not only the making movies expression, which I love, those stories we tell about our lives, but there are a lot of things you hear that are not helpful to people who are going through grief and loss. And obviously we can't cover all of those, but how should people, support those who are grieving a loss of something, a non-death loss? And also, how do you, when you're told those invalidating things, how do you hold your own self? How do you exercise self-compassion?
I'm so glad you brought that up. I think this comes up throughout the cancer experience, not just related to grief, but related to mental illness, related to trauma. I mean, all these different aspects of people sort of saying the wrong things. I think one of the most common sort of sources of that is a lot of people have this sort of instinct to fix, right? They want to be fixers, and it's a good instinct. It's coming from a good place. But so a lot of the time what they want to say is something like, well, at least you caught it early, or at least your prognosis is good, or, look on the bright side, this, or the other thing, right? So there's, a lot of people might jump to saying something like that when you express that you're dealing with a feeling of loss. It's not helpful, and folks who have heard that, I think, can feel that way, even when the person's intentions are good, like I said. So one thing that you can do in that moment, so I'm a big proponent of open communication, especially if this is a close loved one, if this is like your partner, someone in your family or your chosen family, a close friend, or even like a member of your medical team. If what you need is someone to just listen and say, that's so hard, I'm sorry. And what you're getting instead is, well, at least, you caught it earlier, whatever the thing is. I think the best thing you can do is say that out loud. Just say it to the person, say, you know what, actually, what I really, I really appreciate you trying to help, but what I need right now is just for you to listen and kind of be with me in this dark moment. That's an uncomfortable thing to say. People aren't used to saying, this is what I need from you emotionally, but as soon as you open that door, it's gonna make your relationships much healthier. So someone in one of my support groups talked about this concept. You can see I learned so much from the people that I work with. Talked about this concept of climbing down in the hole. So he and his partner were dealing with a cancer diagnosis. She was the patient, he was the caregiver, and she was really depressed by her new diagnosis, and reasonably so. It was all normal stuff, and he was just finding himself trying to say, okay, well, let's be positive. Here's what we should do. Here's a step we can take. And so once he learned to, what he called, climb down in the hole with her and just be in that dark space, be in that uncomfortable sadness with her, it was like a light switch flipping. Suddenly they're able to cope as a team. She's doing better because she has this support. So, if there's any caregivers watching this, I would actually encourage, to step out of your comfort zone a little and feel willing to step into that sort of uncomfortable space of grief and sadness with the patient. It's not easy, but it is incredibly meaningful, and it can make truly all the difference in your coping and their coping with this experience.
The last thing I would like to talk about is, how does one get help for grief and non-death grief and loss? What would you recommend that people do?
Yeah, so, getting help is so important, just like every aspect of, dealing with the emotional experience of cancer as a patient or as a caregiver. And two of the most important things you can do is seek out therapy or a support group. In dealing with feelings like this, you need somewhere to put them. So feelings like this, they can build up, and if you're not talking about them, it can really exacerbate things and make them a lot harder. And processing grief, I mentioned before, it's non-linear. It's something you're probably going to need help with now, maybe 6 months from now, and there may be a stretch where you feel like you don't need as much help. So just realizing that you should always reach out and get support is so important. So professional support, in the context of therapy or a support group, are both great options, and you can ask your medical team if they have any referrals for those, or do a Google search in your area for cancer support groups. And then, the other important thing is to seek out help from the people around you. So we talked about communicating with your loved ones about your experience with grief and, how they can best support you. So, being vocal and being honest about what your experience is with the people that you really trust and feel like you can talk to is a huge asset as well.
Thanks so much, Rosie. This was so helpful as usual. I loved our time together. If this video was helpful to you, click like and subscribe. What that does is it helps YouTube find other people that this will help, just going through things just like you're going through. And don't forget to visit Yerbba.com for your personalized report that tells you about your treatment options and what to expect.